as you can see, there are over 100,000 hospitalizations every year, and about 16,500 deaths are caused by internal bleeding or other gastrointestinal problems that are caused by non-steroidal anti-inflammatory, or we call them NSAIDs. And you can see ibuprofen, Aleve, aspirin, naproxen. Those are just some of the examples of NSAIDs. So typically people who have pain, the first thing you're going to do is go into your cabinet, or you run to the store and you may grab, one of these things to help you with your pain, or if you go to your doctor, they're going to write you usually an NSAID that's prescription strength. It could be Mobic, it could be diclofenac. Some of you may be familiar with those, but again, those are also NSAIDs, and they contribute to these hospitalizations and also these deaths, unfortunately, because of people having pain. And these are things that are not abused. These are things taking as prescribed. It can lead to that problem. Now, when I was my first job out of residency, I went to school in New York. I moved out to Las Vegas. New York is very expensive, a lot of taxes. And so I want to go someplace warm. I got tired of scraping off my windshields and all those taxes being taken on my check, every 2 weeks. So we moved to Vegas and I worked at this urgent care, primary care setting. I saw this patient, it was a guy in his late 40s, early 50s, in great shape, but he complained of how tired he was. I mean, he was very tired. I could see it that he was tired, but he looked like he was in good shape. He was not taking any, medications or anything like that, no medical issues. But he was just complaining of being tired all the time. So I said, okay, well, let's just do some blood work. And when I get it back, we can talk about it and see if there's anything that shows up. So the next day I get the labs. I had the nurse call him immediately, and I told him, I said, you need to go to the emergency room, and you're going to need a blood transfusion. And then when I saw him several days later, I didn't understand why he needed a blood transfusion. But when I saw him when he got out of the hospital, he told me that he had been taking some ibuprofen because he had this chronic pain, and that's what led to this problem. So that was one of my first cases, as the fresh out of residency, someone taking these NSAIDs because they had chronic pain. They weren't abusing it, taking it as prescribed, and this led to GI bleeding, which caused his hemoglobin to significantly drop, causing the fatigue, and which led him to needing a blood transfusion. So these are things, even though they're over the counter, they are not benign. They can cause problems. So I just want you guys to be aware of this. This is why it's important to find some other natural ways that we can help with pain. All right, so let's move to the next slide. All right. So the first thing we're going to talk about are foods, because foods, as you know, foods are, our first line of defense. We are what we eat. And so the first thing I want to talk about are foods, because foods can be inflammatory. So if you already have inflammatory conditions going on, these foods can, lead and put fuel on the fire. So if you remember before, those medications are non-steroidal anti-inflammatory drugs. So the goal with pain is always to reduce inflammation. The inflammation is what's causing the pain. That's why you may get a steroid shot. If you have a shoulder pain, a back pain, a hip pain, you go to the doctor, they'll give you steroids because they're anti-inflammatory. And so foods can be inflammatory. So the foods we need to stay away from, as you can see here, the processed foods, the baked goods, the cereals, white breads, crackers, pasta, the pastries, a lot of things that people enjoy eating. That's one of the things that the church gets me on is they always serve these foods, on Sundays when we have events. And I'm like, okay, we got to find some healthier options. And those of you, who are involved with setting these events at the churches, you know what I'm talking about. It's like, what can we do, otherwise instead of continuing this inflammation process? The fried foods, we love these, the processed and red meats. Sugar is very inflammatory, so really need to avoid sugar. And also these artificial sweeteners. If you've seen those little blue packets, those pink or blue, those packets on the table, those are artificial sweeteners. They are inflammatory. So you also should stay away from them as well. And then common cooking oils, the vegetable oils, the corn, the peanuts, sunflower, safflower, these are also inflammatory. So we really need to, eliminate these foods altogether, focus on whole foods. So let's move to the next slide. All right. Now, this is going to be a little confusing for a number of people because a lot of these foods, these are healthy foods. So I'm going to break this down a little bit. The first one, dairy. Dairy is inflammatory. Now, it is a good source of protein, but a lot of people have allergies to dairy. It can have, stomach issues, joint pain. You may not be aware of it. So get rid of the dairy, especially if you have allergies, asthma. That may be something that could be triggering these things you're not aware of. But nightshades. So nightshades, there's a little controversy in the literature when it comes to nightshades. So people who have arthritis already, people who have autoimmune disorders, already, there are some studies that say that nightshades can add inflammation or increase your pain already. But if you don't have arthritis, if you don't have autoimmune or other inflammatory conditions, then I would say go ahead and eat these foods, right? So nightshades are tomatoes, potatoes, chili peppers, bell peppers, eggplants, and there's other ones on there as well. But nightshades can be inflammatory for people who have, those conditions. But if you don't, then I would say don't worry about it. The next ones are foods that are high in purines. Purines can lead to gout. So if you have gout, definitely stay away from it. All right. Now, these are things that are naturally produced, in the body. But sometimes people have a hard time getting rid of it. And that's the issue. So the anchovies, sardines, trout, tuna, scallops, those are examples of foods that are high in purines. So you definitely want to keep the purine content on the lower end. If you can have your uric acid levels, check people who have gout. These are foods that you definitely need to minimize. I'm not going to say avoid them, but just don't overdo it. And then lastly on this page is foods high in oxalates. Now, these are things naturally found in nature. These plants produce these things so they can keep out the insects, things from attacking them, right? These are things that are already naturally, in us. But these, high oxalates can be, inflammatory. They can cause a lot of issues. So I'm not going to say to avoid them, but definitely minimize them. One of the things I teach my patients, and we're all guilty of this, is that we eat the same foods all the time. And that's not how nature was designed. If you think about, hundreds of years ago when we were working off the land, different seasons, there's foods that would come in different seasons. But nowadays we can get food anytime we want them to, just because of the technology that we have. So we tend to eat the same foods all the time. And that can create an inflammatory condition. It can create allergies and sensitivities that we normally wouldn't have if we would just rotate our foods. So definitely your fruits, they come in different seasons. So eat the fruits that are in season. Okay, rotate your meats, rotate your vegetables. Don't eat the same things all the time because that can lead to inflammatory conditions. So you see there's foods here that are high in oxalates. So again, if you already have arthritis or you're suffering from those things, minimize these foods. I'm not saying eliminate them because these foods are very good. They have high antioxidants, they're cancer fighting. There's a lot of good nutrients in there, but we also know they can cause inflammation if you overdo it. So again, rotate your foods, be aware of, the oxalates and the purines and the nightshades if you already have some inflammatory conditions, because these may worsen them. But again, I'm not saying to eliminate them, but definitely, minimize it. All right. Next slide, please. All right, so let's talk about some foods that are health. So foods that contain high omega-3 fatty acids. Omegas are great for a lot of things, brain health, cardiovascular health. They reduce inflammation. So salmon, mackerel, herring, cod liver oil, oysters, flaxseed, chia seeds. These are great sources to help um, elevate your omega-3 fatty acids. Also taking, fish oil capsules can be helpful as well. But just adding the foods in there, these foods are very good to help reduce inflammation. All right, next slide. In addition, olive oil, again, one of my favorites. These help to balance the omega-3s and omega-6s. In this country, we tend to have too much of the omega-6s because the omega-6s we see in a lot of processed foods. And so we do need some omega-6s, but unfortunately the ratio is way too imbalanced. And so the olive oil helps to put that back in the balance. So ways that you can get some olive oil, just besides cooking with it, is salad dressing, in light pasta sauces. I love putting it on popcorn. Those who love popcorn, some salt and some olive oil, that's great instead of using, butter or the artificial butter. Just try using some olive oil, a little bit of salt, Himalayan salt, keep that sodium down. And, that tastes fantastic. Grilling a steak, putting a little bit of olive oil on there is very good, very tasty. Those of you who made homemade soup, I love putting the olive oil on the bottom. This adds a little extra the seasoning and a little texture to it. Definitely tastes, really good adding that to the bottom of the soup. And I put bread on there. If you make homemade bread, that'd be the great way to go. But, bread, again, is inflammatory. Gluten, we should stay away from the gluten as much as possible as well. That is something that, one is adding a lot of weight and obesity to our country. So homemade, if you're making it yourself from scratch, that'd be the way to go. but it's another option to use. If you go out to restaurants, you'll see sometimes they'll put butter on the table, and some place will actually use the olive oil. You can dip in olive oil, to make the bread a little bit more tasty. All right, next slide. All right, continue with foods to help. Berries. They contain antioxidants, called anthocyanins, and they have anti-inflammatory compounds. And so these are great for, fighting cancer, helping with other inflammatory conditions. This is all about reducing inflammation. So you cannot go wrong when it comes to berries. That's raspberries, blueberries, blackberries, strawberries. Those are great foods to have into your repertoire. I recommend that people make smoothies, in the morning. That way you can put a couple cups of different berries, in there. It's another way to get it in there, whether it's frozen, or fresh. Berries are a great way to help reduce inflammation. All right, next slide. Now let's talk about some beverages. Green tea, high in a lot of nutrients and antioxidants, works on a lot of different pathways as far as the different chemical pathways to shut down chronic inflammation. Green tea is known to also help prevent different cancers, specifically breast cancer, prostate cancer. Green tea has a lot of great stuff that is in it. So highly recommend that people, drink the green tea. Now, again, if you're seeing it in stores and they're putting the extra sugar and artificial sweeteners in there, I'm not talking about that green tea. We're talking about just, the herbal green tea without the added sugar and other artificial sweeteners and things added to it. But green tea is a great, healthy beverage. All right, next slide. Another one of my favorites. They've done studies on tart cherry juice. And as you can see, they found that drinking 2 8-ounce glasses per day, it reduced the inflammatory markers in the blood. There are markers that we look at, CRP, steroid, et cetera, for people who have different inflammatory conditions. And it showed that it reduced those markers and also helped people relieve them from osteoarthritis pain. So don't forget tart cherry juice. This is one that can be a very good one for you guys that may suffer from, chronic pain. All right, next one. Let's talk about some spices. All right, ginger, very popular. A lot of studies done on ginger for a lot of things because it has anti-inflammatory properties, right? It reduces the production of the compounds that promote joint inflammation. There's a lot of we call pro-inflammatory cytokines and compounds, in our bodies, and this helps to break that down. And it contains salicylates, and we're going to talk about salicylates in a little bit. But salicylates basically is like aspirin. That's where aspirin comes from. And we know aspirin we use for fever as well as pain. And so ginger contains just naturally these salicylates. All right, so let's go to the next slide. Next spice is turmeric. And I think we've all heard turmeric, the orange spice that's used in curries and other Indian dishes, a very powerful anti-inflammatory compound. Curcumin is the active ingredient in the turmeric that gives it its powerful anti-inflammatory property. So it's the curcumin, that does the work, and they block multiple inflammatory compounds. So cooking with it, having foods that have the turmeric in it, or taking curcumin supplementation will be very powerful in helping you to reduce the inflammatory process. All right, next slide. So let's talk about some herbs. First one, boswellia, also known as frankincense. Multiple studies shows that it helps reduce inflammation in osteoarthritis, rheumatoid arthritis, asthma, and different inflammatory bowel disease. And I gave examples of ulcerative colitis and Crohn's disease. So for those of you suffering from it, boswellia is a good option, right? These work on different enzymes or different pro-inflammatory enzymes, different than the NSAIDs. So you're taking this, you're not going to end up in the hospital with these GI bleeds and the story that I told you about, previously, because there's different pathways that your body uses to, promote inflammation. And so there's those drugs block certain pathways. This blocks other pathways that's not going to cause some GI bleeds. And so if you are going to use this supplement, 300, 500 milligrams a couple times a day has been shown to be very effective. All right, let's go to the next herb. Next one is bromelain, coming from pineapple, and it stems from the pineapple. So if you think drinking a lot of pineapple juice is going to help you, it's not. It's coming from the stem. So anybody who's ever bought pineapple and cut them up, about those stems that are very hard in the middle. That's where they're making this bromelain from. All right, so it's not the juice. Very powerful anti-inflammatory that works by decreasing prostaglandin levels. That's one of the pathways is prostaglandins. And studies show that's been beneficial in osteoarthritis, rheumatoid arthritis, cardiovascular disease, asthma, cancer, basically any inflammatory properties. All right. So if you're allergic to pineapple, you need to stay away from it. Bromelain is also used for digestive enzymes, helps to break things down. So if you take it without food, you're going to have the benefit for the pain. Now, if you're taking it with food, it's going to help you to break down protein and also carbohydrates. So it's also a natural way to help with digesting your foods. All right. Dosages can be anywhere from 100 milligrams to 800 milligrams, 2 to 3 times a day. Another one that can be very helpful for inflammatory conditions. All right. Next slide. All right. Willow bark. This is what I was speaking about earlier. Used for centuries in Europe and China to help with pain, inflammation, and fever. All right. Back then, they used to chew on the bark. Now, the active ingredient is salicin, which converts into silicic acid, in our body. In the 1880s, use of salicin was used to develop aspirin, right? But it doesn't have the same effect, the negative effect on the stomach as aspirin. It's not going to cause GI bleeding, right? Also contains different antioxidants and immune boosting properties, and it's been shown to be very effective, just as effective as aspirin in reducing pain and fevers. So dosing with willow bark, typically between 120 and 240 milligrams, when you take it. All right, and we go to the next slide. All right. Now, one of the things that I want to tell you guys when it comes to taking the different supplementation, I always encourage people to look for, and go ahead and slide up a little bit more too, professional grade products. All right, that is key because a lot of studies are showing that if you're buying stuff over the counter that doesn't have the certification or you don't know where it's coming from, you're not going to have the same milligram dosage. Sometimes it can be counterfeit, etc. So those of you who may have some questions or want to know where they can get some things, I have my email here. So feel free to email me and I'll get back to you at my earliest convenience, and I can set you up with different professional grade products that can help you with your pain and inflammation. A lot of those herbs that I spoke about individually, most of the time these companies make combination products. So they combine the willow bark and the bromelain and the ginger and curcumin, et cetera, to be a very powerful product to help with reducing pain and inflammation. So I thank you for your time, and now I'll open up with questions because I'm sure you guys have a lot of questions here, and I'll open up to you, Rich. Eric, let me know what questions they may have for me.
I will, Doc. Okay, Doc, the question is, do you have to use pepper when you use turmeric, and if so, why?
So pepper, yeah, you'll see it a lot of times, piperidine. They use it in there to help with the absorption. So sometimes you'll see the curcumin by itself. Some of these things by itself will not be absorbed very well. So they add the pepper to improve the absorption of the curcumin. So it makes it more absorbable.
So they want to know, is coffee healthy to drink?
Yes and no. So, really, there's no other way to explain to answer that because coffee does have some nutritional value. There are some things that are good for you. But at the same time, they have properties that aren't good for you. For instance, most people are stressed. That means it affects their adrenal glands, which affects cortisol. Cortisol has a negative impact on the body when it's, elevated for a period of time. Well, the caffeine in the coffee worsens the adrenal function. So people who have several cups a day and having all that caffeine just makes the adrenal function worse. And that just lowers your immune system, sets you up for increasing your risk for having all kinds of things that affect your immune system. So that's what it's a mixed question. It's not a simple yes or no. It has positives, it has negatives. I usually tell people, look, if you're going to drink coffee, drink a healthy coffee, something that's mushroom based. I'm a big fan of Ganoderma coffee. I've seen wheatgrass coffee, and it may sound like it doesn't taste good, but most of the people who I've introduced it to, they actually enjoy the taste of it. That way you're adding more nutritional components to it. But just keep it minimal. I said no more than 1 cup a day.
So the question is, if you can't use sugar and the sugar substitutes, what's a good natural sweetener to use?
So there's a couple of things. One is stevia. Now I know some people think stevia is too sweet and they don't like the way it tastes, like it can be too sweet.
Repeat that
Another
again,
one,
Dot. Repeat that first one.
stevia. Stevia, Stevia. The next option would be monk fruit. That's another very good one, and that actually tastes pretty good. We use that when we cook or bake. If you need some sweetener, monk fruit is a good option, and that's monk, MONK, like the Chinese monks over there. Monk fruit. That's another very good option for a sweetener. So those would be my two go-tos because they won't spike your blood sugar, and they are naturally based, and so it's not going to cause inflammation, unlike the artificial sweeteners do.
Okay, so the question is cayenne pepper good? And is there a difference between the cayenne and the black pepper?
When they say a difference, I mean, there's going to be a little bit difference because you can see the color difference. So with the colors, you're going to have different types of um, anti-inflammatory properties, right? So, the color difference is going to make a difference just right there, just with the polyphenols there that are good for you. But they're both peppers, so they're both can be, anti-inflammatories. But again, if you do have some of the um, arthritis condition, the cayenne pepper, could be an issue for you. So you just got to be, cognizant of that. But and that's really the difference. The black pepper, it doesn't fall into that same category, um, as the cayenne peppers or the bell peppers.
So the question is, they noticed that you didn't mention honey as a natural sweetener. So is that something that can be considered?
Um, so the thing with honey, and if you're using, raw organic honey, there are medicinal properties there that are great, right? So I mean, you can use it to help, fight infections, um, immune system. It is great, but it will, spike your blood sugar. It will bring up insulin. So depending on what your goal is, which is why I didn't mention it because I'm thinking of things that won't spike your blood sugar and raise insulin, which creates the weight gain that most Americans struggle with is weight loss. Or so that's the problem. Most Americans are overweight and obese, and so I always think about, okay, what am I going to eat or drink that's not going to raise blood sugar, that's not going to raise insulin. So even though honey does have some medicinal properties, I'm a big fan of honey, it will raise your blood sugar. So that is why I did not mention it.
So the question is twofold. One, what do you have to say about plant-based butters? That's the first question. And then the second question is diabetes reversible?
Well, the second one is type 2 diabetes is definitely reversible. I've helped many people over the years do that. It really is a lifestyle change, and primarily, most importantly, it is a mental change. So it really depends on how you look at food, how you look at lifestyle. Once people start making that mental change and they're committed to getting healthier, then type 2 diabetes can definitely go away. So yes, that answers part two. The first one is as far as the plant-based butters. Um, and it's the same line where I would say same thing with plant-based meat. I'm not necessarily a huge fan of it. Um, a lot of that stuff that they use is processed. Um, especially with some of these so-called plant-based burgers, is just full with all different types of chemicals, etc. So I am more of a fan of, whatever God created, that's what we should eat. We don't need to get in the way and mess things up. So butter by itself, it is dairy, but it's also, a good, healthy, natural, fat. It's a saturated fat. And I know that there's conflicting information. If you read and hear, you'll hear a lot of people say, stay away from butter. I don't fall into that camp. I'm a big fan of healthier saturated fats, not stuff that's processed. The margarines and those type of things, the so-called plant-based, I usually shy away from it. I don't usually encourage people, to use them. Now, if they are truly plant-based and there's only a few ingredients, that's added to it, then I would be a fan of it. But most of them that I've looked at, is usually a bunch of words that you can't even pronounce. You know what I'm talking about? A lot of sentences. So you already know this is already processed. So a lot of things that are processed, I say, nope, stay away from them. Stick with the natural things. Now, if there are a few, like I said, if there are a few ingredients and they've done a great job of just adding a few things that are naturally based, then I'd be fine with it if you can find those.
Okay, so the question is, can you repeat the usage for the tart juice? And what do you have to say about garlic and things like that?
Oh, so the tart cherry juice. So 2 glasses, a day, 8 ounces of tart cherry juice has been shown to help with the reduction of pain and also the inflammatory markers. And garlic is great. There's nothing negative that I have to say about garlic. That just didn't make my top list as far as helping with inflammation and pain, but it has a lot of other medicinal properties that are great with garlic.
So the question is, can you give an example of what a healthy day of eating looks like, breakfast, lunch, and dinner?
Oh, wow. Okay. So when they say healthy, are we talking about anti-inflammatory or just healthy in general?
Yes,
Because
yes.
okay. So um I'm a big smoothie person. So I love having smoothies in the morning. So for me, I would use, and you can use water. You can use, coconut milk. You can add the, protein powders, that are good options for you. And then I add, the berries to it, and that is a good, way to get started with the day. Um, you can also do, some eggs. Eggs are a great whole food. You just can't do it every single day. Some people overdo the eggs, and I've talked about that before. That's, the overdoing of certain foods. Um, Lunch. Lunch would be, something like lean meat. It could be fish. It could be salad that's, loaded with different types of, vegetables. And again, change it up because I will have spinach, I will have kale. So some of those are, have the oxalates in it. But again, you change it up, right? So it's not the same type of, salad all the time. Maybe it's not a spinach salad. Maybe it's just more greens, that are, pea based. So there's different type of greens and lettuce that you can use to, make a healthier salad. And then you can put, the salmon or different types of fish, in this salad or just have that by itself and then cook it with olive oil. So then you add some olive oil and vinegar, as your dressing, if you're doing that for lunch. And then for dinner, just pick a lean meat, So I didn't talk about, well, I did a little bit, like the red meat's inflammatory, but you got to have some red meat because that's a really good source of protein, one of the better source of protein, and our bodies need protein, but if we're talking about just, anti-inflammatory, well, the chicken, different types of fishes, and turkey, and you can grill them. Use the oil. You can use an air fryer in there. Don't fry it, but if you use the air fryer, it's a natural way of frying, so it's not in and making more trans fats. Within that meal. Beans, are not a bad source of um, protein and fats and carbohydrates. That's a really good, option to have as well. But stay away from the rices, stay away from some of the other grains. Some of the grains can be inflammatory as well. So I like to use sometimes a combination of different vegetables. So you have a little bit of starchy vegetable, has a lot of colors to it, and then as well as some of the green vegetables along with whatever protein that we're having. And then olive oil, avocado oil, use some of these other, healthier fats, and that would be good for you as well as far as reducing, inflammation. So I always say if you can find it, if it was living at some point, most of the time that's going to be, a good choice for you to choose. But if it was made and it comes in a box or a bag, or you look at all these different ingredients and names that you can't pronounce, that's usually going to be inflammatory. So that's why I said stay away from those. Keep it simple. And I know sometimes that money can be an issue because sometimes the healthier things are more expensive, unfortunately. Then we have to figure out ways to get around that. And that's why we see a lot of people at Costco or Sam's Club where you can buy these things in bulks and try to save a little money that way. But yeah, stay away from the bag stuff. Keep it simple. The different salads and the lean meats, etc., be the way to go. And then also too, people trying to lose weight. If you find a good shake that you can add things to it, that's another way to help with weight and reducing inflammation. And then with that, you can add seasonings to it. So I'll add ginger spices to my smoothie. I'll add some cinnamon spice to my smoothie. I cook a lot with curcumin. Like when I make my vegetables, and my kids love vegetables. I'll cook a coconut oil and then I'll add curcumin to it with his green beans or broccoli, whatever it is. Because again, anti-inflammatory. And then of course the other seasonings. So most of the time you can't go wrong with seasonings. They're usually going to be pretty healthy for you. So I hope that was helpful for you.
Okay, the question is, how do you deal with acute pain, and if there are any local creams that can be used?
Local creams and acute pain. Those are, yeah, good questions. So then we're talking about chronic pain, but we're talking about acute pain. Um, Tylenol is another option. The problem with Tylenol is you take too much of that, that can cause liver problems. Acute pain, if you take the NSAIDs, it can affect the healing capabilities. And I didn't talk about that in this talk, but if you take too much of the NSAIDs in the beginning, that can interfere with the healing properties, which can lead to chronic pain. I thought about adding that, but since someone asked a question, now we're talking about it. So sometimes in the beginning, you may want to take a little bit of something, but if you take the NSAIDs, too much of that in the beginning, that can interfere with the healing properties of your body because it needs inflammation to heal. Our bodies produce inflammation for a reason, right? So a little bit is good for you. Too much of it, not so good. But if you stop that process altogether, that could lead to chronic pain. So, initially, ice is a very good thing to use. So if it's something that you hurt yourself in the musculoskeletal realm, a foot, a knee, a wrist, something you can put some ice on, ice does a good job of reducing swelling and helping with pain. I would use a little bit of the NSAIDs or Tylenol in the beginning because you don't want to be miserable as well. That's an option. Other things that I've used, Arnica is a great product that can help with acute pain, and that comes in a gel. They also have things that have menthol in it or camphor that can be helpful for pain. Peppermint, lavender, some of those other essential oils, they have essential oils, but you'll see those, they can also help with pain. But those are the most common ones. So as far as creams go, the arnica, the menthol, the camphor, those usually come in gel forms or cream forms that you can apply and rub into the area. CBD oil, they are very obviously they're made. That's one of the properties they have is for pain as well. So CBD is another option for you, although that's not really available. There are some stores around town, I'm sure in that area as well, where you can walk into and find some oils and creams that you can apply for acute pain. That'd be a great option as well because they do help with inflammation and other things. Yeah, so I think those will be my top ones, for now thinking about it.
Okay, they want you to explain a little bit more in detail about the stem of the pineapple, and then what are your thoughts about juicing?
Okay, so the stem is where the bromelain comes from. So that's where they're making it from. So if you're drinking the pineapple juice, you're not going to get the effects because you're not going to have enough bromelain to do anything with you. All you're just going to do is have the sugar from the juice. So that's what the hard part of the stem itself. Anybody who's cut into the pineapple knows what I'm talking about because it's hard to chew that thing. But yeah, that's where the bromelain is made. So juicing, for the most part, I'm not a fan of juicing unless you're using something that captures the fiber as well. And so when people say juice, I don't know what they mean by that. So there's certain blenders out there like Vitamix. That's one of the more common ones that they sell at Costco and other ones. But anyway, so if you put the whole fruit, the whole vegetable in there, it juices it and maintains. You can have the seeds and the fiber, the skin, everything, and you can drink all that. That would be the way that I would recommend it because fiber is so good for your digestive system, for your overall health. And also the seeds, those seeds in a lot of these fruits and vegetables also have, some very important properties that people are not aware of. So in juicing in that sense, I'm a huge fan of. Now, if you're talking about juicing where you're just taking the juice itself and you're throwing out everything else, then no, because that's just a lot of sugar that you're getting from the juice of whatever that you're juicing per se. So in that sense, no, I'm not a fan of it because you're missing out very important nutrients and throwing away the skin and the seeds and everything else. So I hope that answered that question. So depending on how you determine the term juicing, I want to make sure you're keeping everything from that whole plant and fruit together, not separating it that some of the juicers do.
The question is, when you do the juicing, what's the best preference? Is it good to blend it? Like use a blender, like when you're using the blender to like the skin and all of that, does all of that go into the blender together?
Yes, but your average blender is not going to be powerful enough to do it. So yeah, I know what she means by blender, but a regular blender won't last very long if you're going to truly do the juicing the way that I'm explaining. You really have to invest, in one of those, $200+ blenders so that you can actually truly juice the whole, fruit and vegetable, to make it work. If you get one of those, $30, $40 blenders, they'll break down very quickly because they're not designed to juice the whole thing. But then there are juicers out there that literally just, take out everything and you just get the juice. And so those are the ones that I don't recommend. If you're trying to truly be, like have the fiber and have the other nutrients from the skin, because that's where a lot of the nutrients are, is on the outside, and not so much of the juice on the inside. That's just where the flavor and the sugar comes from.
Any special recommendations with someone suffering from neuropathy?
Neuropathy is very difficult to treat. Um, that's a tough one. There's really no short answer to that. There's different modalities that are out there. Um, B vitamins, B as in boy, you know, those are supplements that are created for neuropathy that seem to help. Different concentration of Bs can be helpful. Um, but that's tough because once you hit neuropathy, that means you've already, the blood flow, has decreased. And so now you got the nerve fibers exposed. That's a chronic problem. And now you're left with, exposed nerves, creating the neuropathy. So really the goal would be to, help improve, blood flow, to the area and hopefully over time to regrow. But that's a tough one. Natural treatments for that, that's tough. That's going to be more modalities and working with people, in their clinics and centers that have these different things to help with neuropathy. But there's really nothing, that I can think of anyway orally that's going to really help with reducing that type of nerve pain because that's more advanced. When that nerve is exposed, that's a very painful, uncomfortable, condition to live with. And a lot of times that's from, diabetes, but there's other things that can cause neuropathy as well. Sometimes it could be from radiation treatment, fighting cancer, chemo, HIV. There's other causes of neuropathy. So if it's from those other things, then yes, alpha lipoic acid can be helpful. Glutathione can be helpful. But again, it's not just a one shot, thing. It's going to be a combination of things that help reduce that discomfort. That's not an easy one. These guys
All
got
right,
some
last question
questions, I
now.
see. All right.
Last question. So the question is, would you the seeds when you're doing the smoothies, do you flax seed, acai seeds, all of that? How do
Yeah.
you feel about those?
Yeah. I thought I mentioned those earlier. No, those are great. And that's something I add to my smoothies as well. Because flax seeds, the cancer fighting, good for gut health, anti-inflammatory, the chia seeds, the hemp seeds, those are great, because fiber is so important. I always make sure that people are having, at least, one good bowel movement a day. And it's amazing how many people do not. And so one of the best ways, to have a bowel movement is to increase your fiber content. And so that's one of the best ways that you can do that is by adding chia seed, flax seed, hemp seed, to your regimen. So I'm not going to have everybody raise their hands who are not having a good bowel movement, but I'm pretty sure a good third of that crowd does not. If you're not having good bowel movement, then that means you are basically keeping toxins inside of you, right? That's how your body gets rid of those toxins. And so if you're keeping those toxins, that just adds more inflammation in your body, and your body has to deal with that inflammation. So you got to have regular bowel movements, and chia seeds and flax seeds and hemp seed, like those are great ways to increase that fiber. And you add that to the smoothies. That's a great way to help your body go and get rid of those toxins, which will reduce, inflammation. Great questions. Very, very, very good questions. I see they are into it. I appreciate the questions. Anything else? That's the last one.
Yeah, one last question. One last
Okay.
question. So the question is, what foods are good for your arteries, especially if you're someone who smokes?
So the foods that I mentioned in the beginning to stay away from, that's basically what you have to do. It's not so much what foods are good for your arteries, it's to avoid the things that are not. Because, like I said before, if it was alive at some point, that means walking around, flying around, swimming around, growing, then those are foods that's going to be healthier for you. If you're eating stuff that's made, then that's just going to be inflammatory. So just you got to avoid the processed foods. You got to avoid the fried foods. Those are things that you have to eliminate because that's going to cause inflammation, and inflammation is what leads to disease. So people who smoke, that's an inflammatory process. You're increasing your risk for heart attack and stroke and cancers because those are inflammatory conditions. And so this talk was about these are foods that can help reduce inflammation. So that's why I started with foods to avoid those cause inflammation. Then the rest of the talk was all about how you can reduce inflammation. So to keep your arteries as healthy as possible, avoid the stuff we talked about in the beginning. And most people know what they are, except for some of the ones that you may not be aware of, the artificial sweeteners, because those are inflammatory and you've been told that those are healthier options for you. And that's not true. So I tried to put that in there, so let you guys know, like, yeah, those things are not good for you, despite what you've been told. They are inflammatory. So avoid the inflammatory foods, and that will go a long way into helping reduce the inflammation. But obviously,
One
if you're
last one,
smoking,
Doc.
yep, go ahead.
One last one. He went old school on you, man. He asked a question about a tablespoon of castor oil.
Oh my gosh. When I was talking about castor oil, it brought back memories too, man. I tell you. Oh gosh. Yeah, what about it?
He said, is it good to take a teaspoon of that at least once a month?
All right. So I'm just gonna say personally, just that brings back childhood memories that were not pleasant. And so I can't in good conscience recommend that someone torture themselves by taking a teaspoon or tablespoon of that stuff. Um, I just can't do it in good conscience because that just makes me sweat thinking about it. Those of you who've experienced that growing up, you know what I'm talking about.
Hey,
Um,
Roland, man, you got them laughing, man. They in here broke up, man.
yeah, so I would rather say, cod liver oil would be a better option to go.
Okay. All right, last question. Any recommendations for foods to eat after a workout?
Protein. So that's a good amount of protein is key because after workouts, your body's breaking down and you got to replenish it. There's a lot of issues, but one of the main things, is this a senior crowd? I really can't see them. Is this a senior crowd, 55 and up?
Yes.
Okay. So the issue with aging, what we find, those of us who do what I do, um, is the lack of protein and lack of muscles. So that's what you can see as the people age, they start to become weaker, right? And so when they fall, they break a hip, or you can just see they don't move very well. And that's one of the biggest issues with as you get older is people are not maintaining their muscles. Right? They're not, strength training, and we're not getting enough protein. People really focus too many much on carbs, which is, energy. But again, protein is what our bodies are made from. And you really need a lot more protein to maintain muscle. So we're talking about food and eating right now, but really the strength training is so important. Resistant training as far as maintaining your muscles, because as you age, you want to maintain your sight, you want to maintain your mind, right? And you want to maintain mobility. And the best way to maintain mobility is to make sure that you're strong. And so protein is so key. So that would be my number one thing that you eat after a workout, is making sure that you're getting enough protein. So that's before and after.
Okay, Doc, you can go ahead and close out now.
All right.
We'll conclude our question and answer.
Thank you, guys.
But thank you so much.
All right, they're giving you a round of applause, man. You got about 65, 70 people here.
Oh, that was great. Well, I enjoyed the
Yeah.
talk. Looking forward to talking to them in a few months, and I hope they learned something today and something they can take home and utilize.
Right. We always like seeing you, Dr. Brown, and we look forward to having you again at our doc talks in the year, hopefully this year.
All right, Doc, we are good
All
to
right.
go.
Take care.
Hopefully this year we'll see you again, okay?
Yeah, we will. All right.
Thanks
Take care.
again. Take
You're
care
welcome.
now.
Bye-bye.
All right.
Thanks, Doc.